So it's exciting and a privilege for me today to talk to you, to really give you an introduction into some work that Helen Bevan's been leading and I've been supporting on producing a new white paper to really take forward theory and thinking about change in the NHS and how we go about change in the NHS. We all know that the NHS has a lot of challenges, and we see that every day. We hear it on the news. But also every day on the news we hear about brilliant pieces of local practice and fantastic services for patients that are being delivered by our NHS. And that can really give us some optimism. But what we really need to do is really take that optimism and make it widespread. It's not good enough to have small pockets of brilliance, and it's certainly not good enough to have pockets of poor practice which may be dependent on your postcode or your age or any other characteristic that you may happen to have as a patient. That's simply not good enough. So now we're building up a new rhetoric around change, and how do we move from rhetoric into action? That's what this white paper that we're introducing and launching today is all about. It's really taking learning from around the world, from other healthcare systems, from other industries and from other countries, and distilling that in a way that can really inform the way in which we go about change in the NHS, and particularly about large-scale transformational change which will sustain for the future. So we know that a sticking plaster isn't going to be any good for the things that we have got to change. We really need to do something fundamental. And that's what this white paper will do. It will help us by bringing in some of that learning from around the world and really bring it together in a way that the NHS can learn from. But it's not just going to be a bit of theory. What this is it leads to, it's the how-to. It's the how to make collaborations really work. It's the how to get spirit into people to make the change. It's how to really build a partnership that will support positive change for patients. And what it also boils down to is, at the end of the paper, you'll find 15 practical actions for leaders. They could be organisational leaders, system leaders, change leaders. They are leadership actions which will really support you in making this change happen and sustain in your local healthcare system.